In 2017, 68% or 72,000 deaths were due to drug overdose, per the CDC. That may not seem abnormal to anybody because of the availability of drugs in our company, but what if I told you that those deaths were all related to overdose on opioids? Most of those drugs are legally prescribed. The opioid epidemic is upon us, and it is going to forever change medical treatment. Today I will discuss the causes of opioids, what causes opioids to be highly addictive, what caused the opioid epidemic, and how it will change medical treatment in the future. According to F.A. Davis, opioid analgesics bind to the opioid receptors in the central nervous system, altering the perception and response to painful stimuli. This allows for CNS depression, which is also known as euphoria, which is a high. They are generally prescribed for chronic pain, and the most common drugs that you probably hear about are morphine, heroin, oxycodone, hydrocodone, and fentanyl. So the issue linked with opioids is that since it depresses the CNS, if you continue to take higher doses of it, it will also depress the cardiac and respiratory systems. And the antidote available is naloxone, or the brand name is Narcan. So on this graph here, you can see that say that 130 Americans die every day, which that is per the CDC. And here is the increase of deaths since 1999. And then just here's some more numbers from the Department of Health and Human Services regarding opioids. Pharmacology Clear and Simple states that the Department of Drug Enforcement, the DEA, regulates controlled substance based on schedules. There's 5 schedules, Schedule 1 being the most regulated and Schedule 5 being the least regulated. Opioids fall into the Schedule 2, which means that they have a high potential for physical and physiological addiction. They're heavily restricted, there are no refills, they are only dispensed with a written prescription, and each new supply requires a new prescription. The National Institute of Drug Abuse reports that in the late 1990s, pharmaceutical companies told healthcare professionals that prescription for opioid pain meds wouldn't cause addiction. So that's how we're here today. As we know, research has showed that they are extremely addictive, but they gave this recommendation before they had the research to show that. Also, according to the National Drug Institute of Drug Abuse, it is 6 times greater chance that you will die of an opioid overdose than back in 1999. So what is causing this? The misuse of prescriptions is the number one problem. A lot of patients jump from provider to provider, pharmacy to pharmacy to get new prescriptions and refills. The Department of Human Services states that there is an increase for opioid misuse in people with mental illness, substance abuse, low income, and people living in the rural setting. And for this reason, there are stricter regulations that have been put into place, which I will talk about in the next section. So, what does that mean? It means that now, since we're here, doctors are focusing on not prescribing opioids as a primary treatment for chronic pain. According to Jones et al., healthcare professionals are improving the way opioids are prescribed, following new clinical guidelines, and finding safer ways to safer, effective pain treatment, and to reduce the number of people who misuse opioids. CDC guidelines for opioids of chronic pain need to outweigh the risk with the benefits of providing an opioid. There have been a lot of new regulations in place. Federal laws have monitoring programs in place. State laws have drug laws in place. Insurance companies are switching to requiring pre-authorization. quantity limits and monthly drug utilization reviews. And for healthcare professionals, is ongoing education on prescription opioids, guidelines for properly wasting narcotics, guidelines for writing prescriptions, and locking away prescription pads. As I stated earlier, 130 people died from opioid-related drug overdoses. You might not think that affects you, but it will someday. The new guidelines are making it so that providers are focusing on not giving prescriptions. So hopefully, one day, you will benefit from this change. Thank you. Was it at least 4 to 6 million?